Surgical aortic valve replacement is a common procedure in treating aortic stenosis. Aortic stenosis is a condition in which the aortic valve does not fully open. As many as 300,000 people annually in the United States are diagnosed with aortic stenosis.
So aortic stenosis basically is tightening of the valve in the heart muscle, and what happens, your blood flow to your brain, your heart, your kidneys, pretty much everywhere is compromised. And the symptoms classically that we see are shortness of breath, chest pain, symptoms of heart failure, swelling in the feet. Those are typically present in most of the patients. And as you ask, why is it serious? The thing is, there is no medical treatment for that because it's a mechanical problem. It has to be fixed with a device, either do an open heart surgery or do a TAVR, what we have started doing at Rapides Hospital. And if you don't treat it, this condition can be fatal very rapidly, very quickly. And obviously the quality of the patient also goes down because they have repeated hospitalization with heart failure symptoms.
With traditional surgical valve replacement, a cardiovascular surgeon exposes the heart, the patient is placed on a bypass machine, and the diseased valve is removed and replaced with a new valve.
Yeah. So surgical valves are basically two types. One is the mechanical valve and the others are tissue valve. Tissue valve, they degenerate over a period of time. Usually the lifespan is anywhere, depending on individual valve, from 10 to 15 years, and after that they wear off and the people start having symptoms. And in these people, the symptoms are pretty much the same as you would have aortic stenosis, and basically this is what we are looking in these people. And again, the advantage of doing the TAVR in these people is, without doing an open heart redo surgery, we can go from the groin and put a valve inside an old surgical valve.
Thanks to transcatheter aortic valve replacement at Rapides Regional Medical Center, patients who have had valve replacement once do not necessarily need to have a second open heart surgery. Instead, they can receive a new valve through TAVR.
Okay, so the thing is, most of the time when you look at these people who have aortic stenosis, they are our elderly population. So by the time they get the first surgical valve, especially the tissue valve, which can be bovine or pig valve, once they get it and it wears off in 10 to 15 years, so they reach around the age of 80, 85 by the time their valve has pretty much degenerated. So at that time, these people have other comorbidities as well. So it's very hard or close to impossible sometimes to do another open heart surgery, because recovery time takes forever in terms of post bypass patients, especially in an 80-year-old. So healing is impaired, they have other issues happening. So in those people, these are the candidates which you can try valve-in-valve procedure, what we did, and that's a better option. The recovery time is phenomenal. I mean, in a few days people are out and they can go back to their routine work in 1 week to 2 weeks. So the advantage is, initially people used to be sent out, and in central Louisiana we started the first TAVR program here, and we did a first valve-in-valve procedure here, so patients don't have to go any out. Because remember, these people are sick, it's not easy to travel for them, and it's not easy to stay at outside hospital. And the other thing is, they know their docs here, they know their physicians here, and it's easy to communicate with them. And Rapides Hospital was the first hospital to start the TAVR thing, and now they did the first valve-in-valve, and which I think is phenomenal, and it's helping the patient and the community overall in great length.
The first patient to undergo the valve-in-valve TAVR procedure is doing well and extremely thankful for the new technology available here in central Louisiana.
9 years ago, I was having heart problems, and so the doctor that I saw said I needed to have a valve put in, and it was the aortic valve. So they did that 9 years ago, and I was doing good for a while, and then I started having problems again after so many years. The doctors that I had seen said that there was nothing they could do because they couldn't have any more bypass surgery. And I got so bad, February the 29th, I had to go in the hospital. So I had to get my strength back, and I did that, and Dr. Risby said that he could do it. So we told him yes, we wanted it done. And so they did it in April the 1st, and I could tell the difference immediately. In ICU after the surgery, I didn't have to have oxygen. I don't have any shortness of breath, no chest pains, and just so thankful for him doing the surgery.
For more information on TAVR, visit rapidregional.com.